it's good to be here with pharmacists who see firsthand the struggles that New Jerseyans face when it comes to paying for prescription drugs. Most seniors would be outraged to know that they often pay more out of pocket for prescription drugs than they need to. Yet for far too long, pharmacists have been prohibited from letting customers know when they could be getting a better deal. That's why earlier this year I joined several of my colleagues as a sponsor of the Know the Lowest Price Act of 2018, which I'm pleased to say passed the Senate earlier this week. This legislation is as common sense as it gets. It would put an end to ridiculous gag clauses in Medicare prescription drug plans that keep seniors in the dark when they could be saving money. Make no mistake, the soaring cost of prescription drugs in this country is a complex issue that won't be solved overnight. For anyone who has struggled with a chronic condition like high blood pressure, diabetes, depression, or addiction, the ability to afford your medication is not just a matter of health, it is a matter of wealth. It's not about being able to support your family. It is about being able to support your family, to do your job, to succeed in school and retire comfortably. That's why I have been fighting for bold solutions in the United States Senate to combat abusive behavior in the pharmaceutical industry and hold drug companies accountable for outrageous price hikes. But Know the Lowest Price Act is a smart step forward. If it passes the House of Representatives, and we are urging our colleagues in the House to pass it swiftly, and is signed into law by the President, it will bring a much-needed dose of transparency to prescription drug pricing under Medicare. And all consumers deserve access to information. That's why I've also sponsored the Patient Right to Know Act, which would eliminate these gag clauses from health insurance plans under the Affordable Care Act as well. Both pieces of legislation would deliver tangible savings to Americans who too often pay more for their prescription than the pills actually cost. And both pieces of legislation speak to a bigger problem with healthcare in America that goes far beyond prescription drugs, and that's the total lack of transparency throughout the system. It's a total illusion to say that the United States has a free market-based healthcare system when you consider the fact that most Americans have no way of knowing what healthcare goods and services actually cost. Think about it. When you're buying a home, we compare interest rates from different lenders to make sure that we're getting the best deal on a mortgage. When you're buying a car, we look at pricing manuals to find out what's a reasonable price to pay for the make and model we want. And then we try to get a bargain at our local car dealership. And I haven't even gotten into the world of price comparisons available to shoppers online. But healthcare in this country is a very different situation. Special interests have worked to keep the system as opaque and unfriendly to consumers as possible. And this lack of transparency ends up hitting people in their wallets every step of the way. Patients who need surgery are unable to shop around for the best price, so they go under the knife with a wish and a prayer that they aren't whacked with a huge medical bill. Expectant parents have no way of knowing that one hospital may charge $10,000 to deliver a baby, while the one around the corner might charge $5,000. And as the pharmacist here today will tell you, patients often have no way of knowing that they could often save money if they simply paid out of pocket for their prescription refills. With this system-wide blockade on pricing, it's no wonder why America's healthcare costs keep going up. Providers, hospitals, pharmacies, all of the players in our healthcare system don't have to worry about people shopping around for the best deal. It's especially frustrating when you consider the fact that the stakes with healthcare are so high. A person's health is their single greatest asset. Yet we make more informed decisions when it's time to buy a new toaster than when it's time to get an MRA or start a new drug therapy. The Know the Lowest Price Act is a modest proposal, but we have to put things in perspective here. The passage of this legislation in the House could be the first big step towards breaking the concrete wall that surrounds how drug pricing works for and against the American people. If we can show that ending gag clauses delivers real savings to Medicare beneficiaries at the pharmacy counter, we will have a stronger case to make for greater transparency throughout America's healthcare system. Too often patients, in the midst of fighting cancer or managing a disease like diabetes, have to become insurance billing experts in order to get answers on the costs. And it doesn't have to be this way. Soaring healthcare costs are only to become a greater challenge in the years to come as millions and millions of baby boomers head into retirement. The fiscally responsible thing to do is to start building a healthcare system that is more affordable, more transparent, and more accountable to consumers. And that means building on the progress we made under the Affordable Care Act. So look, I'm proud of the gains the Affordable Care Act delivered to New Jersey. Today, nearly 1 million New Jerseyans across our state have coverage due to those landmark reforms. But the fact remains that healthcare costs remain a major concern for nearly every American family. And clearly, President Trump has no intention of doing anything to help them. He talks a good game about lowering drug prices and providing better, cheaper health care to everyone, but in reality, he hasn't made things better for anyone. That's why as Democrats work to protect patients with pre-existing conditions from President Trump's attacks and prevent this administration from sabotaging our health insurance markets. I'm going to keep fighting for solutions that deliver real savings to New Jersey families, from the pharmacy counter to the operating room to the doctor's office and everywhere in between.